My name is Dr. Karen Herring. I am an emergency room nurse. I work for the Department of Homeland Security at the Center for Domestic Preparedness. I also work for a local hospital emergency room here in Virginia Beach, Virginia, and I am a nurse specialist for Virginia 1 DMAT, or Disaster Medical Assistance Team, for Health and Human Services, or HHS. Over the past 16 months with our Disaster Medical Assistance Team, I have been deployed 6 times to support with COVID operations. One of my deployments was actually going into what we call the SOC, or the Secretary's Operations Center, and that is housed in Washington, D.C., and that is where all of our central operations for COVID were happening for our country. And what I was able to do as a nurse, I was providing all of their COVID testing. So anybody that was coming into the building, anybody that was going in front of Congress or the president, I was one of a team, there's 2 of us, that was there, that was doing the testing to make sure that everybody was COVID negative before they went before any of our nation's, leadership. When I was in 3rd grade, I knew I wanted to provide care to people, and I wanted to help people when they needed it the most. And disaster nursing definitely provides me with that opportunity. We're able to go in the worst of times and be able to provide that care and that support in non-traditional settings, which is definitely very rewarding. I was working as a technician in a cardiac intensive care unit. I was a patient care technician, and we actually had a person walk into our hospital with a bomb. They had a bomb that was strapped to them. We did not know at the time if it was real or fake. And we had to activate those emergency plans, that emergency operation plan. And I remember having to walk around and look into different patient rooms, and our responsibility was to look for secondary devices. And we were walking around, we were looking at different areas, we were checking our patient rooms, we were checking the hallway, the stairs, and I didn't know anything. I didn't know exactly what I was looking for, what is a secondary device, what should I be looking out for, how would I protect myself and my patients. And that was a feeling that I never wanted to have again. And I think that truly was the moment that kind of turned me towards that. And then later, about a year later, I saw that team, and I knew that I wanted to be a part of that. We have to be prepared. We have to be able to protect ourselves, be able to identify threats against us as nurses. And that's one of the things that I'm very passionate about. And I'm looking forward into the future, to be able to bring that to light a lot more in the nursing community and in nursing curriculum, to be able to protect the next generation of nurses, and for the next generation of nurses to realize that our world is changing and nursing is changing, and we're going to have to change our culture to be able to accommodate for how our world is changing around us.